Welcome back to Prime Morning. My name is Asieduwaa Akumia, and it's Good Living segment time. Kindly get interactive with us on all our social media platforms. And now, this entire month of May is Purple Month or Mental Health Awareness Month. And what is it that you know about mental health? That is the reason that earlier, when the show started, we did say that you need to be a part of this particular conversation. So if you have any questions at all, our WhatsApp number is very active. Start sending in your questions in relation to mental health. The experts are in the building this morning to answer it all for you. We need to really understand what mental health is, and that is the reason that we are starting this series right here on Prime Morning on Joy Prime. Now, my guests are Yennusom, Maalog, who is the Vice President of the Psychiatric Association of Ghana. Good morning to you.
Good morning, Asieduwaa.
All right. And then we have Samuel G. Panti, Clinical Psychologist and Counsellor, Ghana Psychological Association. I'm actually itching so much to ask him something that is really unrelated to the conversation, but yeah, let's stick to what's the conversation. Hello, Samuel.
Hello.
Good morning to you.
Good morning. How are you?
I'm doing good. Should I still ask you, though?
Please, no.
Okay. Because I think he has an idea what I want to ask you, so he's preventing it. But good morning, gentlemen. How are we doing?
We are doing well. Yeah, things are tough, but we are doing well.
Yeah, I know. Things are quite tough. It is well.
It is well.
There's always light at the end of the tunnel, so yes, definitely.
Yeah.
We'll be fine.
Yeah.
Now, mental health, Purple Month. Somebody would not really understand why the color purple, first and foremost. But I would want us to really help us understand the reason that the month of May has been put aside to create or to push the awareness of mental health. So, yes, Yennusom.
The month of May has been set aside by the Mental Health Authority to create or to raise awareness on mental health issues.
Yeah.
Typically, 10th October each year is a day worldwide set aside as World Mental Health Day. But best practices across the world, usually there is a month like May, like in America and the UK, that they use to raise a lot of issues on mental health. So the Mental Health Authority has decided that starting from this year, May every year will be used to raise issues on mental health. So I will raise awareness across the country. Yes, and there are other activities like doing an outreach, but mainly to raise awareness. To let people know more about mental health issues in Ghana. And the color purple stands for hope, support, and then encouragement. So just to help people going through or struggling with mental health issues. And we are not immune to it. So purple is a good color.
Yeah.
Very true. Now let's get right into mental health. Yeah. What really is mental health, Samuel?
Right. So when you say mental health, we should first understand something. In health, as a person, as a human being, your physicality is connected to every aspect of you. Okay. Yeah. Your mental health is mostly about your thinking process, how positive your thinking is, how you deal with stress. How you see yourself, how you feel yourself, how you know yourself, and how you relate with any challenges that might come your way. It's not specifically about you having a physical health issue, meaning you don't have a mental health issue. It's a part of us that help us to kind of sleep well, kind of relax, kind of feel good about ourselves. So mental health in general is a holistic and it's a big thing to do with,
Just to add on to what my colleague has said, look at the WHO's definition of mental health. It's more or less puts things in context. Like you were saying, not just the absence of mental illness, but so it says that mental health is essentially a state of well-being in which an individual, whether you or me, can realize his or her own potentials.
Okay.
Yes, can cope with the normal stresses of life.
Right.
And then can be productive and fruitful.
Like the way we are doing our best, regardless of things being hard.
Yes. And then also can make a contribution to his or her community, That's what mental health really entails. So the ability to even enjoy life, to feel good about yourself, That's what
It's
we
all
refer to
mental
as
health.
Yeah, it is.
So not the absence of not having a mental illness per se.
Yeah.
You know what I mean?
Because for the longest period, I know that quite a number of people out there, that's all we know.
Yeah.
That's what we know. So your mental health, people even mistaking mental health for mental illness, thinking that they are all the same. It's just that they are just synonymous.
It's a thin line, yes.
It's a thin line, exactly. Okay, now what's the theme for this year?
All right, so the theme for this year is movement, moving more for
Our mental
mental health. Yeah,
Movement.
yeah, and moving more for our mental health.
Moving more.
For our mental health.
So physically,
Physically.
we are moving.
Physically, we are moving.
We are walking.
Yes.
We are doing.
We are jumping.
We are jumping.
We are playing.
We are playing.
We are moving. Yes.
Okay, so that's leading us to what? Exercising, basically.
Yes.
Physical activity.
Yeah, and it influences on our mental health. So, as I said from the beginning, our physicality is connected to every aspect of us.
Yes.
Now, so when you move more, when you exercise more, when you jump more and all that, it tends to produce some hormones in us called the endorphins. The endorphins make us feel happy about ourselves. It makes us feel euphoric. Now, when you feel happy about yourself, how do you feel? You feel good when you're walking.
Very relaxed, okay.
Your self-esteem is high and all that, yes. So exercise has an influence on mental health as well.
Okay.
Exactly. That's how come we took that
So
thing.
basically, so is that the only thing that physical exercise does?
No, I mean,
the endorphin.
so physical exercise or moving, engaging in exercise or physical activity, it also helps you get good night's sleep or get a good sleep.
Yeah.
And if you are able to sleep, this sort of improves your cognitive functions and then also helps you or prevents you from getting a number of mental health issues.
Yeah.
Aside from that, you know, exercising also lowers your stress levels.
Yeah.
You know, it's more like a stress reliever.
Yeah.
You know, so I mean, it tends to lower the stress hormone we call cortisol.
Okay.
You know, stress up, these hormones are high, and then can lead to other physical conditions. Exercising also serves as a distraction from negative thoughts. Let's say you are worried about so many issues, like you have been alluding to, you know, things are not going well, business are crashing, etc., etc.
Yeah.
And you go out there, you are in the gym or you exercise, at least you are distracted small, you can focus on something. The fact that you are able to achieve a goal in, let's say, your exercise, you are able to do 50 reps of push-ups and you're able to do that, you feel good.
Right.
Aside from that, I mean, exercising,
It kind of keeps you fit.
yeah, it keeps you fit and gives you a good body image. You feel good about yourself, you know, walking in and you are feeling good.
Very confident.
Yeah, you feel good.
Especially if you have a flat stomach.
Or six-pack. Six-pack.
Yes.
Or the chest is coming out.
Yeah, super confident and everything.
Yeah, exactly.
But are there specific workouts that you need to do to improve your mental health?
I wouldn't want to go into those, but just encouraging more physical activity, you know. I mean, something basic. Yeah. I try to do push-ups and then some squats and then some few things. And after, I feel so good when I'm sweating.
I don't know, not sitting in the office for a very long time. Not sitting behind the computer for a very long time.
Okay.
Getting the opportunities for at least a break, just walk around and come back.
Yeah.
Yes, and not be in traffic in a car for a very long time throughout your whole day. Maybe somebody might stay at maybe far around like Pukwasi thereabouts, come to work, you stay in traffic throughout till that time. Yeah. You kind of live your life in traffic sometimes, unfortunately in Accra. Yeah. And it's challenging. At least we want you to just at least sometimes walk, park your car, not exactly at your workplace, get the opportunity to walk to your workplace. At least just
so
exercise
be quite intentional about that. Not necessarily parking in the parking lot, but you can park somewhere. Yeah. Just so you can
get the opportunity to walk. At least be intentional about it.
Okay.
That's what you're talking about.
That actually isn't bad. I think I need to adopt that.
I'm taking walks.
All the time.
Evening walks.
Yeah. Evening walks, yes. Should be conscious about it and decide.
Of course, in a more secured place.
Yes.
Exactly.
That's why I'm careful not to prescribe any specific thing. What works for you? But move for your mental health. Yeah.
So what is the number of minutes or hours would be appropriate for you to be seated at a particular spot? Let's say you sit down for 2 hours maximum. you should be up and running for like about 30 minutes.
You are going more into a fitness.
That's
why I don't want to go into an area that I'm not an expert on. But I mean, I'm just saying, I mean, the point really is, let's be more active.
Yeah.
I mean, aside the mental health benefit, we also know the benefits you get from
exercising.
But adding up to that,
and then etc.
Adding up to that, of course, we do have some apps that are online. If you probably want to figure out the number of minutes you need to sit and the number of minutes you need to walk around, I think we have the Pomodoro. I think that was given to me by my boss.
A number of the when you go to the number of steps you take in a day.
So you can just sit for 25 minutes. After some time, it will notify you that you've sat for long. Just take a minute or 5 minutes of walk, come back and restart. At least that will move you and make it more encouraging and more kind of good day for you. Yeah.
All right. Now let's come to certain things or some of, let's say, lifestyle changes or certain things you can adopt to help with your mental health in general.
Okay, right. So lifestyle basically is one of the major things when you have to do with when you are want to work on your mental health. Okay. The first one I'll say is we prioritizing sleep. Yeah. So it's a challenge for you as well.
Oh my goodness.
Right. You might probably be at the studio for a very long time, get home very late. You have to come in the morning because you have another show in the morning. Yeah.
So you even get home and can't sleep at all.
Exactly. Yeah. And sleep, it's the pillar of mental health.
Okay.
If you don't have good sleep, literally you are not healthy. And as I mentioned, your health is connected. So physical, spiritual, emotional, psychological, and all that. So you have to prioritize sleep. Get your quality sleep and get your quantity sleep, your number of hours of sleep and the quality of sleep. And then other things could be connecting with people. So we are social human beings. When I say social beings is we are not created in isolation.
Yeah.
You have to speak to someone, you have to chat with someone. Yeah. So when you have a challenge, open up to somebody at least you can trust. If you can't trust anybody, come to us as professionals who have the conversation with you. Connect to human beings, connect to nature, go to the beach sometimes, go for walks sometimes, enjoy the green sometimes, breathe. I mean, pause in life. It's like every day we are running, every day we are moving. Take a pause at a point in time and just relax and have time for yourself. And be mindful of what you think about as well.
Okay.
Yeah.
Okay.
Being positive about life.
Exactly.
Yeah.
I mean, things are tough, but sometimes those setbacks might just be blessings in disguise.
Yeah.
I need to be positive. Always look at the positive side of life.
Yeah.
All is not lost just because and the setbacks are there. And I keep telling people, encourage them. Once there's life, I mean, there is hope. Yeah. Aside that, like he alluded to, please talk to someone when you feel overwhelmed or bothered by something. Someone you can trust.
Yeah.
Don't keep it all to yourself, Talk to someone. It's absolutely important.
Especially the men.
Oh, thank you.
Men or women?
I will say
men. No, because you men bottle up a lot.
Really?
Exactly.
And all of that.
Men are able to hang out with the fellow guys and
we
tend to be a bit, we're not wanting to...
You are more expressive with each other.
Yes, men are able to
do
that more.
We do. However...
We hang out more.
Yeah, men, we are free, actually. That's one of the things. We can connect with anybody.
But bottom line, try to open up.
Open up.
That's right. Yes. It helps a lot. And the sleep bit is absolutely important. And the fact that we even suggest that move more for your mental health would help you to sleep better.
Yeah.
Okay.
Eating well.
Eating well.
Yeah.
Okay.
And eating at the right time.
Want me to go? Because I don't want Yennusom to come and tell me that he's not an expert there, so because he's not a dietitian. You're not a dietitian, so you don't want me to go deeper into that. Yennusom, why are you doing this? Okay, so what should be the latest time that you can eat? I think that one,
So we will say before 6, at least if there's anything heavy, it should be before 6.
Okay.
Yes, I'm just giving a tip when it comes to persons who have diabetes. That's the advice we give you. Eat before 6 p.m. if there's anything heavy. So I can get at least 3 hours after the 6 p.m. to digest and find time to sleep afterwards. And of course, whatever you eat should be, we'll say colorful. Yeah. Mostly colorful. When I say colorful, I mean you should have all the colors there. It's not at least there. A little bit of green, a little bit of peas, a little bit of protein like fish. It should be quite colorful. Like, yes, it cannot be just white all the time.
Yes,
it should be colorful. That's what I'm trying to say. Yeah.
Okay.
So it's balanced diet.
Balanced diet. Okay. Now let's come to common challenges that mental health related. What would be some of the common ones that individuals face or go through?
Yeah. So in Ghana, research has shown that depression, the anxiety disorders, substance use disorders, schizophrenia, bipolar disorder, and then epilepsy are the topmost mental health conditions that are prevalent in Ghana, with depression and anxiety being
at the top. Can we go through the list again? So depression, anxiety,
schizophrenia, substance use disorders, bipolar, and then epilepsy. Epilepsy, seizure disorder.
Oh, how I wish we had enough time to go through. But we have the entire month to take it one after the other and delve into it deeper. So yes, I'm excited about that one. So then at the end of the day, so all these ones that you've said, you mentioned which ones are the topmost?
Depression and anxiety.
Depression and anxiety disorder. Please, can we delve a little bit into that part?
Which one?
The depression and anxiety, because a lot of people still can't really differentiate between depression. Oh, I'm depressed. I think I'm depressed or emotionally. You get me? So it's like we find it quite difficult really defining how we are truly feeling about being depressed or feeling anxiety. So help us really understand.
The fact that you've had a setback, the fact that your boyfriend has jilted you, the fact that your club has lost.
Yennusom just have to say that.
The fact that, let's say you've lost a parliamentary primary election, then you are down for a few days. That doesn't necessarily mean that you are having depression. The timelines are important. But whatever the case is, if your symptoms, i.e. feeling sad or having a low mood, decreased energy, loss of interest in things that previously used to give you pleasure, persists for at least 2 weeks. Yes, and then interferes with your function, i.e. your work. You are not able to come and sit at the studios, interview us, or I'm not able to go to the consulting room, attend to my patients, or I can't even drive to work. I feel like I don't have energy. Things that affect my work.
Eat well, sleep well.
Eat well. You may not even be sleeping well, at least for 2 weeks. And there's clear interfering with your work or your functioning. And you can say you may be suffering from depression, But just a day or two setback or it doesn't mean that you are depressed.
Right.
Yes, anxiety disorders are a separate group of disorders from depression, which the depression is a mood disorder. So the anxiety disorder, typically you have overactivity of what we call a sympathetic nervous system, which is actually like an evolution or something in us, by the fight or flight. So you have your heart beating fast, you may be sweating, like something's happening to you, and it may not even be so. Right? It's more of an imaginary something fear. So the person anxiety disorders, we have various types. I'm not going to go into them, but we have generalized anxiety disorder, we have the panic disorder, we have the specific phobias. I'm sure you might have heard of a number of phobias, like claustrophobia, agoraphobia, etc. So with these ones, typically the general symptom will be the increase in the sympathetic activity, whereby you have the palpitations or fear of something about to happen. They may have sweating, tremors, and in severe circumstances, they may not be able to even do anything, But for the specific disorders like panic disorder, person will have recurrent panic attacks, whereby the palpitation, that is, has feeling of the heart beating fast, not able to, or breathing fast too. Having tremors, feeling that something bad is about to happen to him or her, out of the blue.
Exactly.
Just keeps saying, and look, these are real. It happens. you know, and I mean, a lot of people go through it.
So with the panic adding up, especially when somebody has gone through a traumatic incident, maybe you've gone through something that made you so scared and so afraid in life, you tend to relive it. So sometimes you'll be there and it will still
It's like a replay.
It will just replay again.
Yeah.
Let me just go back to Dr. Maalog's comment on your boyfriend or your girlfriend leaving you at right, so that's one of the things that almost everybody goes through that, right? And so it replays at a point in time. It pops back, and if it was really, really painful, it went through a traumatizing situation for yourself, it makes you go through some of these, like the panic attack, and you relive it. It's not something so easy. It's quite an issue. See the person's eyes so red, shaking, sweating, so confused.
Okay.
Yeah, so it's not as mostly say, oh, I had a panic attack. It's not mostly might not be like that.
Yeah.
It's much more serious.
Wow. So, men and women, with the cases that you handled, men and women, what would you say really with men? This is what you can tell that this is what they suffer most when it comes to their mental health. With women, this is what they suffer most when it comes to mental health.
So, for example, depression, the female to male incidence ratio is 2:1. That means that twice more females present with depression as compared to men.
Okay.
The jury is out as to the possible reasons why. That's what the research shows. When you come to bipolar disorder, the ratio is almost the same.
Oh, okay.
So it is condition by condition. That's what the evidence shows us, really.
Mind you, let me mention this. So anxiety and depression, I'll say they're like cousins. So mostly there's a high possibility when you are trying to test somebody's, whether the person is going through depression, there's a high possibility you will see some symptoms of anxiety in the person.
Okay.
In the same way as anxiety, if you check the person's anxiety level, by the time you realize there will be some aspect of depression popping up at a point in time. So you don't deal with depression alone without dealing with anxiety. You deal with the two of them and be ready to know that if this one is popping up, there's a high possibility the other one is popping up. Underlining of it is stress will be there. Right, so you deal with the stress, you deal with the anxiety, you deal with the depression. That's how it goes.
I don't know, but I think I chanced on somewhere that in general, when it comes to mental health in general, women report, like the cases, it's more women as compared to men. And I also heard that it usually has to do with a woman, usually has to do with emotional issues, like heartbreak, divorce, breakups, and all of that. How true is it?
So I think we are moving into the realm of etiology or causation. I teach, so I usually tell my students the exact cause of mental health disorders is unknown, but we know that it is a combination of several factors. Biological factors, psychological factors, social factors. Yeah, so...
you teach, that's why. Okay.
So
I now get it. Yennusom.
So what you just alluded to, divorce or those, yes, could be possible contributory factors to someone presenting with a mental illness. Yes, but as to whether a woman presents more to this,
so it's actually something that people say a lot on social media.
Right.
Yeah, but I mean, women tend to be more health conscious. What I know.
Okay.
So maybe that will lead them to seek for help at the hospital, and some of these things could be picked up.
Yeah, and based on my experience, this is my experience in therapy. So in therapy, mostly when maybe a woman comes to therapy, and in the course of the conversation, we realize that we need the husband to come in addition to the woman. Sometimes it becomes a challenge. Because most of the men, based on my own experience, most of the men find it a little bit challenging to talk about their actual issues to other people. So we've been created in such a way that we process things internally. We don't process things outside. So, of course, the woman, maybe the wife, will nag and talk and complain and this and all that. The man will be quiet. Let me tell you this story. So I'll say this about my mom and my dad. Sometimes something might be happening at home, and Mom will be complaining about maybe dad buying something or doing something. Mom will nag and complain, and that will be quiet like the way Doc is quiet. We'll be quiet for a very long time. After nagging, she's fine. About a day or two, then my dad will come and will be like, do you remember what we were talking about last time? She's forgotten, but my dad is processing it, even though she's not talking to anybody.
Okay.
Right.
Okay.
So men are like that. They mostly internalize things that they think about. But then ladies, they will come out, they will go to the hospital, they will check up. Something small, they will check up. But then men are not like that. So, yeah.
Incredible. Now let's come to the accessibility or the availability of quality care for persons living with mental health. Right. So, Yennusom.
Yes.
How accessible is it?
Yeah, I mean, mental health care is quite accessible, but there's still a lot to be done. I mean, from 2015, a lot has been done. Ever since the new mental health law, the Mental Health Act 2012, Act 846, came into being, which led to the creation of the Mental Health Authority in 2015. Yeah. That's now more or less, what's the term? Supervising mental health in Ghana. You know, one of the objectives of that law was to decentralize mental health care. Admittedly, we still don't have enough mental professionals, i.e. psychiatrists, in the regions, the districts, but the numbers have increased. Yeah. So in terms of personnel, the numbers have increased. In terms of access, geographical locations, we have decentralized mental health care to the extent that when you go to any public hospital, government hospital, district, regional, there's a mental health unit. The only challenge is that the quality of the personnel. So usually we have the nurses who were not typically trained to be prescribers, you know, but they are now the one administering medications. So what we are doing is that we try to train the prescribers at the primary care level, other health professionals who are not specialist mental health professionals, be able to pick up the basic mental health condition so they can actually provide treatment. So more like integrating it to sort of increase the access for people getting mental health care, you know. And also, I'm not with the government, but at least I know the Agenda 111, there's this drive to build 3 more psychiatric hospitals in the Middle Belt, Northern Belt, and I think there should be one in the Southern Belt. I pray and hope that is also going on well to increase access.
Yeah.
Regarding the access, I think there's been progression. I wouldn't say there's not been any progression. There's actually been quite a number of progression. I know University of Ghana, University of Cape Coast, and KNUST, and quite a number of universities, UW, provide a lot of clinical psychologists now, a lot of counselors now. They provide a lot of psychiatrists now. So it's progressing, right? I think one of our challenges, we might say, is it's not getting to everywhere yet, but there's been progression. Now, my major concern has to do with the schools. It's not gotten too deep to the schools yet. I'm talking about sleep, but senior high school students don't sleep for 8 hours as you need to get, or 7 and 8 hours, or maybe 9.
Especially when you get to final year.
Exactly.
Yeah.
They don't get it. Yeah. You have to sleep very late after prep, and you have to wake up very early for your plot work. You will not get a chance to at least get your energy back. So that's a challenge. You have to give them a space where they get the opportunity to have conversations when they have problems by themselves. And that's what I'm saying, it's not too bad, because in Ghana, we do have some schools that are doing great. So I'm in a school, and my school is doing great, I'll say that.
In terms of mental health?
In terms of mental health, right. So in terms of mental health...
So you've created that avenue where they come to you, they speak about...
Yeah, so...
Okay.
Yeah, the school, I think, about 1,000 students, or less than 1,000 students. We'll have a number of 3 clinical psychologists, 2 as therapists, or 1 counselor intern. So that's like an opportunity where an avenue where students will come to you, have conversations with you, staff will have challenges, they'll have conversations with you. So, like, it's progressing. I think it's not going there, but it is progressing.
So I see that to add more to access. So the access, apart from the geographical and then the personal, financial access to is a major challenge. I work at Panti Hospital. I mean, people are still paying for mental health care, even though the law makes mental health care free.
It's supposed to be free.
Yeah, it's supposed to be free. So that's why there's this push to have the mental health disorders on the NHIS They're on the NHIS, so that people can then be able to have access, can have it free of charge. Well, we are still pushing, but we need to have this whole talk about access, mental health financing.
We certainly have to.
And the way forward, whether we put on the NHIS or we create a specific fund for it to be, and that was the intention. And I know recently MHA Mental Health Authority, they've been pushing for a part of the COVID, leave your COVID, that is still hanging on years after COVID.
Yeah, to be pushed.
I mean, we can have this discussion. I think that we should just have a discussion on mental health financing very soon. Yeah. Try to see the way for it. Because there's no health without mental health.
Because already a lot of people are even finding it difficult identifying whether or not they're going through mental health. Their mental health is being challenged. They're finding it hard to identify that. And not just that. When you move forward onto that, even after you identify, you're able to know. But I think that my mental health is being challenged. There's this fear of, what shows that if I go, accessibly, it will be very easy for me to get treatment. And then the monies, what if I will not be able to afford all that, the treatments or the necessary pills here and there? What if I will not be able to
financial
take care of
access
that?
is a major issue.
Yes.
It's a major issue. And for me, I think this is an election year. The two main political parties should be able to give us their positions on issues.
Right.
What plans do you have for mental health financing?
Okay.
We hear you. We look at that. Let me end here on that.
No, but you're right.
You're right. True.
Yes,
because,
you're right.
Because according to a report, I think that came from World Health Organization in 2020, I guess. I think the percentage of finances that go to mental health is just 1.4.
In Ghana.
In Ghana,
But it should be about 5% of your health budget.
Yes.
We are not really...
We are not there.
Focusing.
We are not focusing. It's not yet.
I mean, I'm sure we have other priorities.
Yeah, I know. But we'll get there.
At this point, the needful really has to be done. No, so let's make it the proper way. Let's do this appropriately.
Yes.
I want to give you both the opportunity now to say properly to government. Let them know this is what we expect and this is what you are looking forward to when it comes to the mental health sector, of the health industry. So, Samuel.
So I will start from what was done in 2013. Now, in 2013, the government made posting of first batch of clinical psychologists across Ghana. And from 2013 to date, there hasn't been any posting again. That's a challenge. So we are hoping that the government actually embraces mental health.
Okay.
Like get us part of your plans and expose us because there are a lot of work to be done. Now, everybody, I would just say the hospitals, I'll say schools, I'll say organizations, we can come here at Joy Prime. I'll have a conversation with you, Asieduwaa, in 5 minutes, and I'll realize that you will realize yourself, I might be going through some challenges, so you have to go to therapy.
Yes.
We've been created to be like, accept, or maybe like, I say, I'm fine when I ask you how you are doing. Yeah. But meanwhile, deeper, you're having some challenges.
There's a challenge. Yeah.
So what I'm saying is generally everybody has challenges. Okay. So the government should come in, spread us out. I think when I was doing my research during my master's in 2021, at that time, the number of psychiatrists in Ghana were just 21 at that time. Now, there might be a number of increments, but still, the challenge is not enough. Yeah. Yeah. So we need to spread us. We need to get us more involved in the plans of any party or any...
Yeah, budgeting and everything.
It should be part, big time,
Yennusom.
Wow. I'm supposed to speak to the government.
Yes.
Okay, Mr.
Let
President.
them know what you expect of what you hope for.
Waiting Minister of Health and then all the stakeholders. Policy makers. Look, mental health is important. It's an integral part of our health. There's no health without mental health. We need to push for more in mental health. Financial access is a major challenge. I.e., people are not able to afford the cost of care, even though the law states that it should be free of charge. If we are going the way of putting it on NHIS, let's fast track it. If we are going the way of creating a particular fund for it, let us get it done. Aside that, there's this general stigma, and this is to everybody, including the government. There's this stigma surrounding mental health for even the professors who have accepted to be in it. So you could think of maybe doubling our basic salary for widows and mental health field, But that way it will
well noted.
encourage, yes, it will encourage more people to get the mental health.
Yeah.
You know?
Right.
Yeah.
I mean, when I joined, we were about 20, but now we are about 70 psychiatrists.
Yeah.
But that is still not enough to meet
Exactly.
the, world standard. Of course, geographical asset we've spoken about is let's work more on that, etc., etc. So, Mr. President,
Over to you.
Minister of Health and all this, over to you.
Yes.
Sure.
Yennusom, Samuel, thank you so much. I mean, with everything that you've said, especially with Yennusom, the parts where got me quite alarmed, this is the prescribers, the nurses part.
Yeah.
I mean, you're not trained, you don't have the expertise to be doing that, but because we are not equipped when it comes to the laborers to do all of that, those that Enyo Mejuma is not their work, they haven't learned for it, are doing it, which is quite alarming. Already there are so many cases in general in hospitals where wrong prescriptions are being given to patients here and there. So if you're going to look at something like this, please, it needs to be attended to with immediate effect.
But let me just add that they're actually doing their best in their constraints,
Yeah.
Hey, Yennusom,
I'm helping. They are meeting the need, even though that wasn't what they are trying for.
Yeah, but it doesn't mean that they are not qualified, though. They are qualified.
No, they are qualified. They are qualified, but I mean, that's not what really they are there for. Exactly. So the people that are supposed to be hired or employed for that, they need to be trained.
Right.
And that is why Yennusom is saying that you are now training people to be able to do all that, which is good. So kudos to you for that.
Right, great.
So the necessary push, financing, the support, you need to be given to make things better.
Yeah. Sure.
Thank you very much.
Thank you very much, Asieduwaa. It's been a wonderful interview. Thank you, Joy Prime. Thank you.
If we get this opportunity most of the time to spread news on mental health, it's to be really helpful. For me, focus schools.
Okay.
I focus schools.
Let's see how tomorrow and the subsequent days turn out, since it's the entire month we're using it, we're dedicating it to the awareness of mental health. So this is where we end the conversation on Good Living segment. My guests have been Yennusom Maalog, Vice President, Psychiatric Association of Ghana, and Samoji Panti, Clinical Psychologist and Counsellor, Ghana Psychological Association. Samo, should I still ask?
No good.
I wanted to ask you something in relation to his name, but you know what?
Conversation. We don't have time.
Gentlemen, thank you so much for your time.
So
next week, I believe, will be an exciting and very, we'll learn a lot next week as well. So thank you so much and have a lovely morning. This is where we end Good Living segments. But a Black Rasta is in the building, and KMJ will be seated with him shortly for an awesome conversation. He has a new song out. He has a whole new album out. And so that will be the conversation for the entertainment segments. My name is Asieduwaa Akumia. We'll be right back.